Okay, we are standing on the right side of the cadaver and the external genital region is exposed. So the male external genitalia, as we can see, what are the parts that we can see here? We can see here the deep inguinal ring through which the spermatic cord passes and is the complete content of the inguinal canal. Then through the superficial inguinal ring passes and then is entering into this is the spermatic cord and entering into the scrotum. We have cut the scrotum longitudinally and exposed the testis. See, we have exposed the testis. Now the layers of the scrotum are seen as a continuation of the layers of the anterior abdominal wall, and that is why the scrotum is also called the second abdomen. Now this is the spermatic cord, this is the testis with its covering. Now if you see, the testis is covered on the anterior. Here we have removed the parts, the layer on the lateral and the medial aspect by this tunica vaginalis. Then the inner covering is this white covering, which is the tunica albuginea, and if you cut it, each of the lobes are of the testis, they are lined by the tunica vasculosa. Now we are cutting the spermatic cord to dissect out or deliver the testis along with the spermatic cord. So now first of all, we see that we hold it in the anatomical position in this fashion. Alright, so how to hold it in anatomical position? We see the different surfaces, borders and poles. There are two poles, superior pole and the inferior pole, or upper pole and lower pole. The upper pole, it gives or has like a cap. This is the head of the epididymis, and inferiorly is the tail of the epididymis. Now anterior and posterior is known by, see, the anterior is free and posteriorly there is the structure which is the body of the epididymis, and the body of the epididymis is slightly posterolaterally placed. So this is the testis. On its posterior border we can see the body of the epididymis. Body of the epididymis is posterolaterally placed. Above we can see this is the cap-like head of the epididymis on the upper pole of the testis, and here is the tail of the epididymis at the lower pole of the testis, and then this tail carries on upward or continues upward as the vas deferens and becomes a content of the spermatic cord. This is the vas deferens. If you touch it, it feels cord-like, and related to the posterior border of the testis, it is posteromedially placed. So this is anterior, this is posterior, this is clear. Now this is the lateral surface. How we can see the lateral surface from the medial surface is we can see this body of the testis and the testis and the body of the epididymis. On the lateral surface, it creates a space or a gap. This is known as the sinus of epididymis. It is placed laterally, whereas on the medial surface there is no such sinus present. If we notice carefully, we can see there is this tiny structure which is the testis, appendix of testis, this tiny structure, the appendix of testis. To the penis, this is the root of the penis, this is the shaft of the penis, this is the glans penis, and marked anteriorly is the slit, which is the external urethral orifice. Now this surface is the dorsal surface, this undersurface is the ventral surface. Now it is covered by skin, the superficial fascia, then the deep fascia is known as the Bach's fascia. Now if you remove the superficial layers and the deep layer, then we see one, the superficial dorsal vein that is removed with the skin and superficial fascia here. Then what we have this is the deep dorsal vein of penis. You can see lying dorsally. Then on either side there are two arteries, the dorsal arteries and the dorsal. This is the deep dorsal vein, the deep dorsal artery, and then the deep dorsal nerve. So there is, the vein lies medially, two arteries on either side, and lateral most structures are the two nerves. If you continue anteriorly, see, we have given a cross-sectional cut over here because to expose the pillars of spongy tissue. We can see this, the two upper spongy pillars, these are the corpora cavernosus Each one is corpora cavernosum and divided by a septum, median septum. And below, this is the region of the corpora spongiosum. This is a single pillar of corpora spongiosum. It is seen here as well, the corpora spongiosum. And if you see, there is an orifice here which is the pathway of the urethra. Okay, so if we pass the forceps through the external urethral meatus, then we will go right through this corpora spongiosum. See, and the forceps it has passed through the urethral orifice. Alright. Now these two corpora spongiosum, these two pillars at the root of the penis, they end as the two crusts, right and left crust of the penis, and this corpora spongiosum, this ends as the bulb of the penis at the root of the penis.